Advisor and Confidential Assistant for Policy in the Office of the Commissioner in the Virginia Department of Health. I call the meeting to order now, and it is a meeting of the work group for Chapter 932 of the 2020 Acts of Assembly. This meeting is being conducted in a completely virtual environment, and it is being recorded. There are several things that we'd like to review about the meeting before we get started. First, if you would please mute your lines when you're not speaking. This will reduce the amount of background noise on the call and the potential for audio feedback. We also ask that due to the virtual nature of the meeting, please identify yourself each time you begin to speak so that staff can accurately record the minutes of this meeting. For those attendees who are not members of the work group, you will not be able to unmute yourselves. However, when we get to the public comment period, you will be unmuted by the host if you have signed up to speak. Ms. Allen, please call the roll.
All right. Alyssa Black Hackett. Megan Green.
Here.
Thank you. Judy Jackson. Karen Brim.
Here.
Joni Latimer.
I'm here.
Gail Thompson. Jewel Brana. Catherine Paxton.
Here.
Charlotte Redoubt.
Here.
Elizabeth Carter.
Here.
Corey Tillman Wolf.
Here.
Kurt Elward.
Here.
I'm sorry, was that a here for Kurt?
No, sorry, that was Corey Tillman Wolf. I'm sorry.
That's all right. Barbara Seymour. Randall Stamper. Todd Barnes.
Yep, I'm here.
Heather Legary.
Here.
Sam Kukich. Bob Kukich. Aaron Hines. Susan Hines. Lionel DeCure.
Here.
Thank you. Tyler Edmonds for Senator Kiggins.
I'm here, thank you.
Christina Holloway.
Trying to unmute.
Yes, is that Ms. Holloway or is that someone else?
Yeah, I'm here.
All right, thank you. Dana Parsons.
Here.
Alicia Cundiff. April Payne.
I'm here.
Scott Johnson. Okay. Vivian McDaniel.
I'm here.
Joseph Hilbert. Heather Anderson. Dr. Pratt is here, as an I. I did notice there's a couple folks who are in our participant list who are part of the roll call but that did not answer. So I'm going to circle back to them. Ms. Kukich, I see you in the list. Are you there? Are you there, Ms. Kukich?
Hello?
Yes, now I can hear you.
Okay.
All right. And then Scott Johnson, I saw you in the list as well. Are you still there?
Yes, I'm here. Can you hear me?
Yes, I can hear you now, sir. Thank you.
Thank you.
Okay. And if you all will just give me one moment, I got an email from Judy Jackson saying that she's having some trouble getting into the meeting. So if you will bear with me for just a second, I am going to send out an event email to her. And unfortunately, you all are probably going to get a duplicate, and I do apologize, but that's the most expedient way for me to get Ms. Jackson back into the call. So apologies if you get another invitation for the meeting that you're already in right now. Okay, so that's been sent. I'm going to go ahead and we'll hope that Ms. Jackson hops on the call with us. So that completes the roll call. The agenda is displayed on the screen. As with all of our meetings, we're going to have a public comment period next. We're going to review the recommendations that the work group will be, the stakeholders in this work group will be voting upon, followed by discussion of next steps, and which will include going over what the voting procedure is going to be, and then the timeline from this meeting to the submission of the draft to the General Assembly. So, and then any other business at the end. With that being said, the written public comments were emailed to you all yesterday. So you should have them. If you do not have them, they are out on the website, or if you'd like me to send you another copy, just let me know and I will have that resent to you. Dr. Pratt?
Thank you. We've now reached the public comment period, and I'd like to review how this works. In registering for the meeting, there was the opportunity to sign up to speak on a topic. The list of persons who signed up to speak was finalized at 11:30 this morning. Pursuant to the Board of Health's public participation policy, each speaker will have a maximum of 2 minutes in which to speak. There will be a countdown timer displayed on the screen, and a bell will ring when the time has elapsed. If the bell rings while a person is speaking, the speaker will be allowed to finish that sentence. Then the speaker will be muted, and the name of the next speaker will be called. You will be unmuted by the host when it's your turn to speak. In addition, all speakers are reminded that this is an opportunity for you to address the work group on any topic of your choosing. However, it's not a question and answer period, and there will not be dialogue back and forth between speakers and work group members. If we have more speakers than the time allotted now, the remainder of the speakers will be permitted to speak at the end of the meeting under the same rules that I have outlined for this public comment period. Ms. Allen.
All right. Thank you, Dr. Pratt. We had one person signed up for a public comment today, so there's no need to call whoever's going to be on deck second. The name of the person who signed up to speak today is Sam Kukich, and if you will give me a moment, Ms. Kukich, I will get the timer put up on the screen. Just 1 second. Okay. Whenever you're ready, Ms. Kukich, I will start the time for you.
Okay. I'm not sure how many more meetings are scheduled for this work group, but as we near to the time where we will be voting and putting forth recommendations, I would like to say how proud I am of the many Dignity for the Aged members who have shared their heartbreaking challenges surrounding the abuse and neglect and death of their loved ones due to understaffing. I have truly been exhausted with the endless hours of research, the volumes of documentation, reports, the phone calls, the political loopholes that have exacerbated the problems with nursing care and which preclude excellent care. I keep hearing, Sam, it's all about the money, and it's true. Everyone is making money off the nursing homes. It's not about providing care for the elderly. Simple math tells you no one will work for peanuts and do a good job. Would any of you here in this group do your job if you were treated like Jen Tedman? Please read her comments if you haven't yet. These issues have been on the front page of our local and national newspapers, and yet everyone is turning a blind eye because there's too much money to be made. And the old people can't do anything about it but die. The recommendations being put forth from this panel are also about money. They do not at all address one of the primary reasons for poor care and failure, and that is nurse and aide staffing levels. We can spend over $2 billion to accommodate training and grants for programs after the elderly are abused and neglected, but we can't figure out how to provide and pay for staff to care for them properly in nursing homes and enforce the quality standards. The same facilities that are fined can turn around and apply for civil money penalty reinvestment project funds. One of the current projects includes $110,000 for a restorative sleep program, and this is supposed to improve residents' opportunities for uninterrupted sleep throughout the night. Really? I guess I have one parting question, and that is, how many more people have to be paid off for the elderly to receive the care they deserve, and will we ever have to establish ratios and provide the proper care? Thank you.
All right, thank you. If you just give me 1 second, I will get us flipped back to the PowerPoint. Okay, can everyone see the PowerPoint?
We just have a public comment period.
Yes, yeah, that's it. I just wanted to make sure. Sometimes it's difficult for me to tell what's being shared and what's being not when several things have been shared one after another. Okay, thank you. All right, and with Ms. Kukich's comments, that concludes the list of individuals who signed up to speak today. So the public comment period of today's work group meeting is now closed.
Thank you. The next item on the agenda is review of recommendations. Ms. Allen will be reviewing potential work group recommendations that have been brought before the group at our prior meetings. This includes revisions to some of the recommendations we discussed at last meeting and new recommendations based on feedback provided at our last meeting.
All right, thank you, Dr. Pratt. So as you all may recall, we went through quite a number of recommendations last time. Some of them we didn't have changes for. Some of them we wanted to revise them to either expand them or to make them more tightly drafted. So the recommendations you're going to be seeing are partially those, and then some that were added as part of the discussion from the last meeting. And to hopefully make things a little easier this time, the recommendations are numbered on the slides. The number that you see them on, I'm sorry? Did someone speak up? Okay, hear nothing. Excuse me, everything is, all the recommendations are numbered. So the order that they are numbered on these slides are the order that they are going to appear on the ballot. So if there are any new recommendations that we come up with today, they're going to be added at the end of the list that's already on here. So I think the list cuts off around 31, 30, somewhere in there. So any new recommendations we may come up with today would be 32, 33, et cetera. But this is the order they're going to appear in, so they're not going to jump around on you when you actually do get the ballots. Okay, that being said, so the first three that are on this slide, this was about the service learning component, the different recommendations that we had come up with, and there had been a request for service learning to be broken out and explained exactly what we meant by that. So the first one is permit but not require local school boards to offer graduation credit for service learning. And service learning is an instructional strategy that combines meaningful service to and for the benefit of the community with curriculum-based learning. And this definition will be the same on all of them, so I'm not going to repeat it all the way down. The second one is statewide offering of an optional graduation credit for service learning. And then the third recommendation to be voted upon is implementing the Fairfax County Public Schools hours-based service learning project model statewide, which is required for students in the grades 6, 8, 12, with optional diploma seal if additional hours are completed beyond the minimums. With these three that are on the screen now, does anyone have any questions as to, or not questions, but has any thoughts on whether they need to be revised, or are we all on the same page about what the recommendations would entail? And I know we talked last time about some of these recommendations might be in conflict with one another, and that will be addressed in the report itself, that, you know, if we happen as a group to vote and agree and recommend things that are in conflict with one another, there will be an explanation in the recommendation section that explains that these are options for the General Assembly. If they were to choose the two that are in conflict, that conflict's going to have to be resolved by the GA, that we understand some of them may be in conflict. So just as a reminder, I know Mr. Stanford brought that up last time. I'm sorry?
This is Barbara. Can you all hear me?
Yes.
Barbara Seymour from DMAS.
Yes.
Okay. I'm sorry. I was having trouble getting connected, so I missed the first part. So you probably already said this, but you're going to go slide by slide, and then we're going to discuss each one that's listed. Is that what you're doing?
So what I'm doing is I'm going down whichever recommendations happen to be on the slide. So this one has 3 recommendations on it. So I've read through what the recommendations are, and so now I'm asking, for the recommendations you see in front of you right now, what changes do you want to see made to this? As a reminder, we're not voting on these today. This is just nailing down the language so that everyone's on the same page about what they're voting about.
Okay. Well, I do have a comment on this slide, because the same thing is being said as far as identifying what service learning is. Why is that being repeated for each one? Is that because we may choose to only pick one of these, or it's just repetitive? And I wasn't sure, the other comment I wasn't sure about is, when the GA folks read this, are they going to understand what service learning is?
Okay.
Because this does not really tell you. And believe me, with all the eyes that are going to lay on this, and the longer it is, the more convoluted it is, the more challenging it's going to be for them to take the time to read through all these.
Understood. So the reason why the service learning definition is repeated on all 3 is because you're right. It may be that only one of them gets through, in which case, if I only put the definition on number 1, but number 3 is the one that ends up with a majority vote, then I don't have a definition of service learning that's right there, easy to see as part of like the top line recommendation.
Okay, I get that.
Yes. Right. So
because that, go ahead.
Okay, and then for your second thing about what service learning entails, this is a pretty broad definition. I picked this one up from, I looked at several states that have service learning already and synthesized their definitions into this one so that it would encompass, that would explain what it is, but not tie us down too tightly, that gives the GA time, or gives GA the ability to modify it if they want, but so that we're all on the same page about what it would be. But in terms of like what's actually in the report about service learning, there is going to be more than just a single sentence saying service learning is this, period. There's actually going to be a discussion about the service learning models that are in other states, how many states have it, how they've implemented. So there's going to be other discussion in the work group report that expands upon this. This is just the recommendation itself for Virginia, but we will have discussion.
Sorry to interrupt you, but in that report, this report that's going to the GA, it's going to be a full report, but it's also going to include specific recommendations. Is that what you're saying?
Yes, that is correct. Yes.
Okay. My only comment still would be, perhaps if we could state that service learning, which provides hands-on, experience or something, and then the rest of it.
Okay. So if I'm hearing you correctly, let me open up a window so I can.
Maybe after service learning in parentheses, put hands-on experience or something like that.
Okay. So I'm just trying to make sure that I'm, sorry, my computer is locked up. I do apologize.
Virtual's great when it works.
It is, yeah. It's locked up, and I can't even get to the control. So 1 second. Let me see if I can get that off the
Can I
screen.
ask a question while we're waiting for technology? And that is, Barbara, can
Yeah.
you, I guess my question in conjunction with what you're talking about, I'm looking at this and I don't know that, will there be concrete objectives so that they say it provides this and this and this and this many hours, so they know what to approve? Otherwise, I feel like it's really loose. Does that make sense? I know you're saying hands-on, and I understand the hands-on, but that still doesn't quantify what we're talking about with regard to, are we going to say there's graduation credit for service learning, which will incorporate A, B, C, D, B skills, or so that they know what they are, or is it just kind of like loose service learning that doesn't say anything to me if I was trying to approve this?
Yeah, I think it depends on how we, as a group, decide to wordsmith this and exactly what this quote-unquote report that's going to include these recommendations, how the report will define what some of these things are, as part of the whole process.
Right, and that's my point. If it's a recommendation, aren't we required to define what those areas would be in order to make a recommendation? Otherwise, it would be just sort of pie in the sky loose. And that's what I'm saying. If I was going to make a recommendation, I would say, yes, we're going to have service learning, and it will require these, hands-on skills as well as, just something, and come out with something on the end instead of very loose. I don't know what that would have.
I think it needs to be specific to each recommendation. I agree that there needs to be some specifics in the recommendation.
So I was going to
more about how the assembly works and everything, so they know how to format it and everything. But I hear what you're saying, and I agree. It needs to be specific.
So
At least defined, yeah.
So could Scott maybe speak to this? Would it not be that these recommendations would then be for the Board of Nursing? That would be their role in developing those areas of the curriculum. Is that correct? Or the hours or whatever would be required to be included?
So this is Rebecca. I'm not sure who spoke up there because it popped up as a call-in user. April. That's all right. Okay. So when it comes to the curriculum-based learning, so I'm going to, if you give me 1 second, I'm going to share a revision that I've made, and hopefully you guys can see this, the Word document that's in front of you. So when it comes to the service learning is not part of your college or further on education. That we're talking, depending on the model that you pick, middle schoolers and high schoolers or just high schoolers. So the educational curriculum and the objectives that they're having to meet, those are all things that are either defined at the school board level or by the Virginia Board of Education. This, setting what that instructional, the exact parameters of the instructional model, the exact objectives that they have to meet, that is something that, the Department of Education or the local school boards, those are the subject matter experts that know how to design and build curricula to fulfill the service learning goals. So my recommendation to you all to take under consideration would be we modify the service learning definition. So service learning is the instructional strategy that combines meaningful hands-on service to and for the benefit of the community with curriculum-based learning meeting specified objectives defined by the school board in the instance of option number 1 that gives the school board discretion as to whether or not they want to do the graduation credit, or in the case of the one that's the statewide version of it, that its objectives defined by the Virginia Board of Education.
Got it. Thanks.
That's fine. I agree with that.
Okay.
But also, I understand the requirements of the school, but don't you need to identify what they're doing in some regard that you say, otherwise,
I think, Sam, I think that'll come later on in the recommendations. This is just laying out, that service learning be considered, so to speak. So when we get down into some of the other recommendations, then, as you're saying, I think within those recommendations, then we specify what type of criteria or who would be developing it or whatever. This is just kind of an intro.
but just to make that clear, I think, and she's covering up the screen, so I can't.
Oh, I'm so sorry. I'm so sorry.
It's okay. But I guess to me, when I read objectives, I'm also a trainer. So when I read objectives, that would go with the specifics of that course, and not the approval of the school. Like the school, the objectives for this learning, what is it?
This is just a recommendation to the GA that we put this out there as an option for the schools.
Right, but I'm saying I would specify the objectives. The objectives, I think, wouldn't be the objectives of this learning. Okay, this, what are we calling it? The service learning. The objectives of the service learning would better be defined as objectives. Better be defined by somebody who's a subject matter expert in the medical field and approved by the school.
So the service learning recommendation that that we were talking about back in July, I guess, July, August, around that time, one of the things that was discussed is that it was service learning writ large, that it wasn't specific to the healthcare field or even specific to long-term care facilities. And the recommendations, which let me flip back 1 second. Okay, so the recommendations that are right here on this slide are not service learning in long-term care facilities, service learning in healthcare. It's just service learning, and it's not that specific. If you all want us to add in as a recommendation service learning, that both this broad option and then a narrower option, that is specific to healthcare or long-term care facilities, we can do that. That's not a problem. But when we had the original discussion back in, like I said, July, August-ish, it was service learning as an option for all students for any field that they wanted to go into.
Well, I guess I thought that we were trying to figure out what the workforce for the future in the medical field was going to be, so I would think that we would fine-tune it to include that. I thought that's what you...
I'm sorry, go ahead.
I thought that's what we were doing here, is trying to figure out how to increase the workforce for CNAs and nurses and LPNs and all that. I thought that was the focus of this.
It is. I was just going based off of what we had discussed back in July and August, because I think it was Miss Susan Hines that had mentioned in her desire to see it more as a broad option. But if there's interest in it being drawn more narrowly as an alternative recommendation to be voted on, I would be happy to do that. So would you want, I guess would the feeling be, and so I'll take the first one, permit but not require local school boards to offer graduation credit for service learning in healthcare or in long-term care facilities?
Well, I think it should go with what I don't have the statement in front of me on what this
That's all right.
is, but it would stand to reason that we would make a recommendation that it would be in this field for long-term care or some kind of preliminary field to get them in this, because the goal is to get more people into the workforce.
Yes. So
right?
the way that it's phrased, the way it's phrased in the in Chapter 932 is the increasing the availability of the clinical workforce in nursing homes. So service learning would, okay, let me think how to write this. To permit but not required service learning in clinical care, clinical services, in nursing homes?
That's the beginning. But I mean, I'd like to see what anyone else talks, but I thought that's what the whole focus of this work group was, to get find ways to increase the workforce, to get the pipeline so that people were signing up to be CNAs since there's a shortage, and get people in the medical field.
And this is Joni Latimer with the Ombudsman Program, and I would, if we're trying to shift things here, I would definitely weigh in with Sam on that. I mean, I think it just makes sense that is the appropriate focus for our recommendations, and we wouldn't necessarily want to dilute them or be sort of addressing things outside of the scope of what we're charged with. So I would say, yes, let's narrow it, and I would think to long-term care even more specifically than just health care.
Okay. So I know the bill says nursing homes, but so in Virginia you have licensed nursing homes. You also have certified nursing facilities, which they're licensed and then they get certified at the federal level. And then we also have something that are long-term care units in hospitals, which are federally certified, but they don't go and get a nursing home license, but it's still long-term care that they're being provided. It's just in a hospital setting. So if we go with service learning and clinical care in long-term care settings, that's going to cover both your nursing homes and your certified nursing facilities, as well as the long-term care units in hospitals. So are we okay with saying in long-term care to get both of those, or do we want to?
I would think I think it's good to keep it open. I think if we get young people into service learning in hospitals, in assisted living, in nursing homes, any of those areas will initiate what we're trying to do. So I don't know that I would limit it to a long-term care facility as much as I would just the medical field, so they get exposed. That's my opinion.
Anyone else want to chime in? If you all will give me a second, I'm trying to pull some of this over so that I can throw this back up on the screen so we can see the revisions.
Well, this is Joni again, and I'll just clarify that I'm in general agreement with Sam on that. I think when I say long-term care, I think these days we're probably interpreting that pretty broadly, and so, it would not necessarily be specifically tied to a nursing facility certification or anything of that sort, and it would certainly include assisted living, which we, I think, have talked about, so sure.
Okay, if you all will give me just 1 second, I'm making some revisions right now, and then I will throw that back up on the screen. So just 1 second. Okay. Now let me see if I can get this to share correctly. Okay, share. Okay, you all should see the Word document again. I pulled over what was on the slide. So we have, again, 1, 2, 3. Permit but not require local school boards to offer graduation credit for service learning in clinical care, for clinical care, in long-term care settings. Service learning is an instructional strategy that combines meaningful hands-on service to and for the benefit of the community with curriculum-based learning meeting specified objectives defined by the local school board in consultation with Department of Health Professions and Department of Health.
No, I think that's better.
Okay, and then the statewide one is similar. It's going to be for service learning in clinical care in long-term care settings, and it's going to be the same definition for service learning, except instead of the local school board setting the objectives, it's now going to be your Board of Education, again in consultation with DHP and VDH. And then I'm sorry?
That was just Barbara. I said, I agree. That sounds good.
Okay, and then the Fairfax one, since that's an implementation statewide of their model, again, in clinical care for long-term care settings, that one would also be a objectives defined by Board of Ed with consultation with DHP and VDH.
Go ahead.
May I speak to recommendation 3? This is Carol Pratt.
Go ahead, Dr. Pratt.
The language in recommendation 1 and 2 are optional. Number 1 uses the word permit. Number 2 uses the word optional, I think.
Optional, yes, yes.
In 3, we don't have language that is flexible. We have language that is proscriptive, and I believe adoption of these may be more acceptable to school systems if we're not in a position, I don't believe, to mandate this.
Okay, so I flipped it around to make it mirror to a little bit better. So statewide offering of optional Fairfax County Schools model of hours-based service learning in clinical care settings, in long-term care settings. Sorry, in clinical care, in long-term care settings. Too many prepositions. And then I've left the definition. So is that what you're aiming at, Dr. Pratt?
Yes. Otherwise, it looks like a mandate, and I think
Gotcha.
it would fall on deaf ears.
Fair point. Okay.
I have a question. When I was reading this week, I was wondering, is there a way we can look at that Fairfax County Public School model? Because I didn't know what that was.
Yes, I can. I will need to go back and pull the presentation where we talked about Fairfax County's model, because that's where I have all the information at. But I can, I'll pull those slides, and I'll also pull the additional information that I saved when I was doing those slides, and I will send those out to the group.
Okay.
Yeah.
So Rebecca, this is Barbara with DMAS.
Yep.
Dr. Elward is also on with me as far as representative from DMAS, and he and I were talking about these recommendations. And one of his questions was with some of these different items. This is the first one where you're referencing modeling after that Virginia model after another type of program. And his question was, how did we as a state, or how do we confirm that program is working and is I guess worth implementing and making a recommendation to mirror that specific program, this one or any of the other ones that we've mentioned throughout the work group discussion.
So yes, I think I caught most of that. So for the Fairfax model, the reason the Fairfax model was mentioned originally is because that is right now the only county local school board in Virginia that even has some kind of service learning. And even then, it's not service learning as it's used in other states. Other states give credit for service learning, whereas Fairfax doesn't do that. They give a optional diploma seal if you get even more hours beyond what the base program requires. So the reason why we had put the Fairfax model on there is because it's already implemented in Virginia. It's the only Virginia version that we have, and it is an alternative to the service learning models in other states, and that if there is pushback or hesitation from the GA about service learning equaling graduation credit, there is this alternative, the Fairfax model, which is service learning equals optional diploma seal, which you don't get credit for it, but at least would motivate some students to go for this additional endorsement on their diploma. But I can certainly circle back with the Fairfax County School Board and see if they have data that I can provide to the group about this. But that's why we picked Fairfax as a model, is because it's literally the only Virginia model that we have for this particular instance of service.
Okay, thank you.
Mm-hmm. Okay. So I am going to, anyone else have anything on these three before I go back to the presentation? On the rewrites, excuse me, I should say.
Could you take one logistical question?
Sure.
Sure. So this is Joni. I was just curious on where we're going from here. On some of these, I'm just thinking about the fact that we might need to know ultimately what, and I might have missed this, I apologize, what the total number of options, is there a limit on the number of options we would present, or is that open-ended? And second question is that beyond today's discussion, where it seems like we're still sort of trying to get a bit more of a handle on what these actually mean and kind of what basis they're made on, are there opportunities to reform, regroup, take some of A and put it in B, come up with some revised alternative recommendations? Is there space in the process for that?
Okay. So I was going to cover this at the end, but more than happy to bump it up to the top. So the plan for today was to nail down the wording of the recommendations that we already discussed, nail down the wording of the ones that we had discussed last meeting but weren't on the slides because they were brought up as part of the discussion that we were having. And then if you all do have any alternative ones that you want to suggest, like you want to somehow merge 1 and 2 together, don't know how you would, but if that's what you wanted to do, if that's an option that you wanted to see on there as something you could vote on, just let me know and I will be happy to help hammer that out with you right here, right now. In terms of how many recommendations are going to be available to us to pick from, right now you're at 30, 31-ish, if I'm remembering the slide deck correctly. You can have as many as you want to vote from. Ultimately, what's going to end up in the report is the recommendations that garner a majority of votes, a simple majority of votes. So if I give you, hypothetically, at the end of all this, there's a slate of, let's say, 45 recommendations that you all vote from, and only 12 of them end up in getting a simple majority, then only 12 of them are going to show up in the report. If all 45 of them get a simple majority approval, then all 45 of them are going in. So the ultimate number of what goes in really depends on your votes. I can't predict what that's going to look like. But in terms of how many you get to vote on, I mean, that's up to the group how many potential recommendations they want to see before them, which is why we're having this discussion about, are we all on the same page about the wording of the ones that are already listed in the slide deck, and what additional ones do you want me to put in there so I know what to put on the electronic ballot for you guys.
That's helpful.
And
Thank you.
Sorry. This is Carol, and I just want to say that no one recommendation, they're not presented in order of importance. And so when the vote is cast, it will be in favor or not in favor of that particular recommendation on its own merit. It will not stand in conflict with any of the other recommendations at all, and some of them may seem to be repetitive, but even so, you should feel free to vote in favor of anyone that you do support.
I have one other comment about that. I know that we said that we'll get deeper into this as time goes on, but I'm somebody, unless I know the details of how would I know what I'm really recommending and voting for? Does that make sense?
Yes.
So we're looking at the writing of it today, but as Barbara said earlier, we'll get to I'm not putting words in your mouth, Barbara. I'm just kind of, please jump in here. But if we're going to define what those things are, how can we vote on them before we really know what we're talking about?
Since these three recommendations will have a lot of flexibility for school systems, either locally or at the state level in the Department of Education, I'm not sure how we can know a lot of specifics because the drafting of curriculum and the drafting of requirements will be done based on local school board needs and resources. So I'm not sure how much particular detail we will be able to discern ahead of time. We maybe have to look at things globally and not know every detail ahead of time. I'm not sure how we could get that much detail for you.
Yeah, I'm just saying, for example, if I work on a project and I'm going to make a recommendation, I usually know the who, what, where, when, and why, and how much. And so if I was going to vote on something like this and I didn't have that information, I really wouldn't know what I was talking about. So that's all I'm saying is, we can recommend we take somebody to the moon, and that's great, but how do we nail down the real, so that it's realistic, so we can say, here's what we're recommending, this is how we do it, this is who we contact, this is how much it would cost.
So for these types of work group recommendations, I mean, we'll take the education ones that are, I think, still displayed on your screen right now. The implementation of them is going to be handled by the board. And I don't think anyone on the call, except for maybe Randy Stamper, and I don't think he is on the call at the moment, could even give you a realistic ballpark figure of what that cost of implementation is going to be for the Board of Education to do this. So whenever the idea is we present this slate of suggestions, the who specifically has to implement it, is usually, as tightly as we can get it, is usually going to be maybe an agency specification, so in this case, Board of Ed. For the how much it's going to cost, that's not something that the work group has the data to be able to project. And even if we could project it, it's not going to be the official count anyway, because when legislation gets filed, one of the things that's done is that the Department of Planning and Budget has this entire fiscal impact statement process, and they work with the budget analysts and financial folks at the individual agencies to come up with the official fiscal impact estimate that accompanies a bill, and that's the number that the GA works with. That's the number that the GA goes off of. When they're voting on legislation, if it's got a fiscal impact, once a committee, let's say, decides to report it out, if it's got a fiscal impact, it's going to be a report and refer to finance, or report and refer to appropriations, depending on what house you're in. That's how they pick the number. So even if we spent the time, which I don't think it would be an efficient use of our time, to come up with what the dollar amount's going to be on these things, it would be at best a ballpark that they may or may not take into consideration, because it's not going to be the numbers they're ultimately going to be using during the GA to figure out the cost of the thing.
Right, and I'm not asking really about that. I'm just really saying, okay, so we make a recommendation, and excuse me, but I haven't been in this process before, so this is a learning curve for me as well. But if we make a recommendation, we should have, if I was going to have a party, I'd say, okay, Barbara, you get to make the cake, and Carol, you get to bring the punch. And, you allocate things in different ways so you know how the job's going to get done. So what I'm saying is, what resources do we have to know that these recommendations could work?
I'm going to try to answer your question, and if I don't, please let me know. So let's say the General Assembly goes with option number 2, and they say service learning is now going to be an optional graduation credit statewide. Board of Ed, figure it out. When they do the budget projections, the fiscal impact statements for it, one of the things that's part of that disclosure and calculation back to the GA is what are the resources the agency already has available to it that they could utilize to fulfill the mandate of this hypothetical bill, and what additional resources would they need in order to, whether it's staff funding, whatever, in order to meet that need and to meet the mandate in that bill. So it's the agency that gets tasked with fulfilling the mandate that tells the GA whether they already have the resources and they can do it, or they need additional resources. Here's what they are, and here's what it's going to cost.
Okay, I understand now.
Yeah.
Thank you.
Yeah. hmm So again, I mean, if this were just, I can just, from my own experience, if this is just going to be regulations that they'd have to promulgate, that's usually estimated at $5,000 or less, and it's a non-issue. That's not a big ticket item. I think the fiscal impact would be no fiscal impact because it's such a small dollar amount, for example. Just because regulations tend to be the one that comes across my desk that I have to give input on for fiscal impact. Okay. So I am going to flip the screen back to our PowerPoint. 1 second. So you all should see the PowerPoint, which is numbers 1, 2, and 3 of the recommendations, the ones that you originally saw. We have revised them. I'm going to go with what we had on the that Word document that I just showed you. So I'm going to advance to the next slide. Okay, so you should be seeing recommendations 4, 5, 6, and 7. Now, based on our conversation last time, there was a request for, originally volunteerism and service learning were paired together. There was a request that we break those apart, so I did. And then there was a request for one set to just say appropriate supervision, which means that were these to become bills passed, signed by the governor, et cetera, appropriate supervision is going to be defined by the agency that has that's given the responsibility of implementing it through regulation. 6 and 7, again, volunteerism and service learning is broken out, but there was a request for supervision to be more defined as to what would make it quote unquote appropriate. So that is what you see before you right now. We'll start with the ones that are more broad. Is there any issues with 4 and 5? With the wording of 4 and 5?
This is Barbara again, and I understand what you're saying as far as breaking these things out in various arrangements, combining them versus keeping them separate and that type of thing. But I think 6 and 7 pretty much, if we want to limit the amount of confusion as to all these recommendations that are going to be voted on, I think it would run smoother if we just use 6 and 7 and delete 4 and 5, because, and then if there's issues with, because one of my recommendations was with appropriate supervision and training. I don't think you want to just have supervision and what is appropriate supervision. I mean, we could go on and on that one. So 6 and 7 to me are more specific into what we're recommendation and what we're recommending and what that would look like versus just saying supervision. But I hear what you're saying as far as breaking them down and giving a lot of options. But again, I get concerned that there's going to be so many we're going to be voting on that it's going to be tough to distinguish the difference between some of these, and these two already have all the components in each of them. So that's my personal opinion. Take it for what it's worth.
All right, thank you. Anyone else's thoughts as to whether 4 and 5 should be stricken? So
yeah, I agree with Barbara.
I agree also.
Okay. So, sorry, I'm just taking some notes so I make sure I got all this straight. Okay. Now, does anyone else want to speak in favor of keeping 4 and 5? Since we've had some folks say that they want them off, does anyone feel strongly about keeping them on? Now is your time to say something. Okay. Not hear anything. So 6 and 7. So the reason why these are slightly longer is because there was a request for more specificity about what supervision would entail, what appropriate supervision would entail. The same definition or not same definition, but the same concepts are in both 6 and 7. The only difference is one is talking about volunteers, one is talking about service learners. Are there any changes that you all want to see made to 6 and or 7? Assuming it's and. Whatever changes you'd make to 6, you'd make to 7, but please let me know. Okay. Not hearing anything. I'm going to go to the next slide. And I also just wanted to let everyone know that Ms. Brim is going to have to be hopping off the call to join a separate call. So just wanted to let everyone know that she's going to be departing the meeting here shortly. Okay. Next slide, you should see 8 through 13. 8 is establishing education and outreach programs for middle school and high school students to promote career pathways and long-term care. 9 is funding for tuition of the advanced certification for CNAs upon the conclusion of the pilot program. 10 and 11, you may recall we had some confusion about which program we were talking about. Got this hammered out in between last meeting and this one. So number 10 is expanding eligibility for the Nurse Loan Repayment Program that's established in 32.1.122.6:04. That is the Mary Marshall Nursing Scholarship that that was brought up last time. That's the exact same program. That program doesn't currently have, CNAs are not eligible to take advantage of that program, so this recommendation would expand the eligibility pool so that CNAs could take advantage of it. Okay. The second, number 11 is the funding of the Nursing Scholarship and Loan Repayment Fund, which is in 54.1-3011.2. That one is an unfunded program. The program exists in statute. If you go to that citation that I have there, you'll see it, all the criteria for it. It's actually, there's even a specific long-term care component to this particular fund in number 11, but there is no appropriation for it. And unlike number 10, which has Board of Nursing fees supporting it, there's no separate fee program that supports this. So in the absence of general funds, there's no money. So that's what 11 is about. 12 and 13, there was some discussion last time about child care and transportation. Originally, these were smashed together as one thing, so I've split them into two. So one's transportation, one's child care. And then there was a question as to whether these financial programs were supposed to, like how much of it was supposed to be paid for, was it supposed to totally cover child care and or transportation? And the discussion at the time was that no, whatever financial relief program it would be would only cover a percentage of the cost. It wasn't intended to wholly offset. And then there was a question as to what nursing home employees we meant by this. So I tried to specify that a lot more clearly in this write-up, and to make sure that it is focused in on our CNAs, LPNs, RNs, the ones who are directly providing the care, who are also parents or guardians of children. So
12 and 13.
12 and 13.
Financial relief programs for our workforce are incredibly important. I would love to see us look beyond only those who are looking to have support for childcare and for transportation. There are many other pressures on this workforce that are not enumerated in 12 and 13. And if we could come up with a holistic financial relief program that would not penalize those who have pressures with no children or who don't have transportation needs but who need their light bill paid, I would think that that would be a good way to go.
So trying to think how to write that in my head. So establish financial relief program. It would still, Dr. Pratt, are you still seeing it as for the direct care and nursing home employees?
But not only limited to child care.
But not only the parents, yes.
Yes, not to eliminate some who are CNAs who have pressures, financial pressures, but who don't fall into one of those two categories covered in 12 and 13.
Okay.
Can I ask you what other areas you're talking about?
Maybe someone who's a CNA who's also providing adult care for family members at home. They may have pressing needs around that person's care at home, for instance. I'm sure we could come up with a long list of other financial needs that go well beyond child care and transportation for our CNA workforce. Like for us to provide solutions for those only who need child care or only who need transportation. I'm sure that we could ask the CNAs, what do you need help with? And there would probably be a long list other than childcare and transportation.
My only concern with adding to that list is I'm seeing dollar signs, budget, that kind of thing, so I'm not sure. I mean, we're just gonna, this type of thing comes up when I work with brain injury population, and back when we were looking at a brain injury waiver, and you get to the point where you decide, okay, especially when it comes to budget issues, you want to capture fewer people but more services, or more services but fewer people. So I think if we go too far in a laundry list of things and scenarios that should be covered as part of this relief program, we'd have to be careful about that, because again, you're looking at, if the GA awards a certain budget for that particular relief program, maybe we need to reach out to the CNAs, like you said, and find out what's the biggest area of concern that they have, or what would be the biggest need that they would have for some type of financial relief. Because as you said, there's a multitude of scenarios that families are dealing with, and we can't be responsible for all of them.
I'd like to add to that. There was a CNA who wrote something, and I included it in my comments, the written comments this week. Some of the issues that she talked about were just understaffing. I mean, if we take away the stress and all the other issues, maybe they won't have so many. Jennifer, the girl who wrote comments this week, her basic thing was it was understaffed. She hurt her back. She can't be a CNA anymore because she's physically incapable of doing it now. So I think there are things that we can help them with on the job with regard to staffing that would benefit relief, if we're talking about relief.
Yeah, but I think this is more for in the financial world, so I get that. I think there's going to be more down the road in these things, these recommendations with staffing issues, because I have some comments on those too. But anyway, I think this is just focusing on financial support and keeping it in that bracket of the financial world.
Well, in conjunction with that, then, the only other thing I've heard is, provision for scrubs or helping them in that regard. You know what I'm saying? That might be a hardship if they can't afford the scrubs or the shoes or, something like that.
Okay. If you all will give me a second, I'm going to reshare the Word document, and I'm going to, I'm going to try to share the Word document. Okay. So you all should see the Word document. So 8, 9, 10, 11, none of them got changed. So 12. So this one, to Dr. Pratt's point about some folks having to provide care for dependents who may not be children. So what I did is for number 12, I took out the who are parents or guardians, just deleted that. So it's still direct care nursing home employees, and now it's by covering a percentage of child care or dependent care costs. Does that help clean that up for you, Dr. Pratt, that first one?
Personally, I don't pretend to know what people need help with.
Okay.
So my personal view is that we ask for money to be relief to be given to these individuals and let them choose what to do with it, because they know where they need it. One month it may need to be for scrubs to equip themselves for their job to go to work. The next week or the next month it may be fuel bills. I would like more flexibility, but I am certainly a minority voice here, I think.
I don't think you're a minority voice. I'm all for paying them more. So, it's like, why should we have to make a special fund for this when in fact if we paid them enough that they could provide for themselves and it gave them a decent wage, we wouldn't have to worry about any of this.
Okay.
More global, and like Dr. Pratt is saying, because none of us really know exactly what each family is going through, but by covering a percentage of, I don't know, designated needs or something, and then, like you said, it'll be a certain amount. I think the General Assembly would need some kind of explanation, but I'm not sure how to best capture. I understand what you're saying, and I agree with it. We could take, for example, some of these topics or some of these areas, but give them flexibility as to what it could be used for.
So I'm just trying to think of how to write a more global recommendation. So, established financial. And I, by the way, also took out parents and guardians out of 13 as well. So, I mean, oops, duplicated that. Covering a percentage of living costs, including but not limited to, and then we can just put a list in there, which may include, and then put that as a list.
I don't know how else to say it. I agree. Yeah.
Okay. So this one's going to be more of a catch-all. So you're going to see a repeat of the transportation and child care thing. Dependent care. I don't know who's going to be the determiner on this one. The General Assembly? I mean, yeah, the General Assembly, because it'd be legislation, but I don't know if I would want to specify a specific agency because I don't know which agency would have a wide enough portfolio for this, to be very honest with you.
Why don't we just say as determined? I'm just kidding. You can read the General Assembly.
Okay.
This is Lionel DeCure with Dignity for the Age. And I'm just having trouble understanding all this where you put in where we give them extra money for shoes, we give them extra money for this, we give them extra money for that. All of these fluff things that the lawmakers are going to have to look at. Why not just give them a living wage? Because all of this stuff they're going to have to look at is just, just too much when it can be solved with a living wage. That's what I don't understand.
So the living wage issue is actually, I think, on the next slide or the slide after. It's on one of these slides. I think it's the next one. So living wages is going to be a recommendation for us to vote on. But again, this is just a slate of potential recommendations for the GA. And so if hypothetically the living wage one is not successful, but the financial relief programs are, I'd still want to have that as on the slate of things available to vote from. But the wage issue is one that is addressed, and I think it is addressed on the next slide. So if we're okay moving forward with the next slide, I think we can discuss the wage issues because I think it is on the next one if I'm remembering the numbering correctly. Okay. Okay. Yeah, it was the next slide. Okay. So this is 14 through 17. So the first one is increasing, it's a duplicate because of the metric that you'd use, increasing the wage for CNAs proportional to regional standards, being United for Project Data work. The second one, nearly the same, except instead of using United for Alice project data, instead you'd be using the MIT living wage calculator. And I played around with the numbers on both of these. The difference between what is a living wage between United for Alice and MIT is, it's usually cents. I mean, we're talking like, oh, this one says like, oh, it's $10.51 an hour, and this one says it's $10.63 an hour. The difference is not substantial. But either of these are available, and both of these projects have it broken down by county in Virginia and in other states, but in Virginia they have it broken down by county, and you can, the data that's available, you can look at the living wage for just one single adult living by themselves. You can look at the living wage for 2 adults, living wage for 2 adults with however many number of children. So both of these have available to them the ability to really drill down and figure out what the living wage needs to be on the regional. And for the region, I went with local workforce board regions because those are, I mean, that comes from the Virginia Employment Commission, what those regions are. So they have, as subject matter experts, have a better concept of how the regions break down in Virginia according to the workforce. And the only thing that we have really in the Department of Health, and I don't think it's the metric we'd want to use, which is why I don't have it on here as an option, is the health planning regions, but that's for health planning, for like planning facilities and need for hospital beds or MRIs and things like that. That doesn't really tie to the workforce board regions. So that's why I went with that instead of the health planning regions we have in at VDH. So those are the living wage ones. And I also, yes.
What is a living wage? I mean, what is the amount?
So it depends on where you live, and if you will get in general. So it can be. So I'm gonna assume we're talking a single adult, no kids, not married, nothing like that. Depending on where you live in the state, that can be anywhere from $10 an hour, and that's obviously going to be a very rural setting that we're talking about, or it's going to be something closer into like the between $15 to $20 range per hour.
Well, it's funny because, you know, I know a CNA and she makes $12 an hour. She has a college degree. And we sat down, we thought, you know, it's interesting because if you're a babysitter, I don't know how they come up with this wage, but if you're a babysitter and you're just taking care of one child, you know, you're walking in my house, you're eating my food, you're playing with my kids, you're making a mess, and you walk out, you know, 5 hours later, they get about $12 an hour, and they have really no skill set. And I look at what a CNA does, and I'm wondering how they come up with, if you look at the typical day that I submitted on the comments this week, what she has to do constantly, even before noon, and you think, wow, $10 an hour, that's interesting. So where can you live for $10 an hour?
Well, like I said, it depends on where you're at in the state. So if we're talking Lee County, for example, I mean, that's the farthest
where I live right now.
South of.
Okay.
I'm sorry?
Where I live, she's getting $12 an hour. And I live in a pretty good area.
Okay, so I am, if you will give me 1 second, I'm going to pull them up in the browser. So Suffolk City. Okay, so obviously Lee County's $10 an hour is going to be different from Suffolk. So let me see if there's a way I can.
Well, she lives in Williamsburg, so, you know.
Oh, well, just give me a second. Suffolk or Williamsburg, I don't have a preference on which one we pick, but I'm just trying to compare apples to apples for you so you can see. Williamsburg, that's in James City County?
James City County, yes.
James City County, thank you. Okay. So 1 second. Let me share my Chrome window. Okay. So right now you are looking at, this is the MIT one. This is the MIT Living Wage Calculator. So for over here in the 1 adult, 0 children category, the living wage is $13.58. Okay. Poverty wage is $6. Minimum wage, $7.25. Minimum wage is going to be the same across the board. You can just kind of move beyond that. But it's $13.58 according to MIT. Now, for the ALICE project, this is the same. Where's it at? Am I in the right county? Yes. Okay, so this is the ALICE project. And to give you the hourly wages, I hope you can see where I'm hovering. For your single adult, no kids again, it's $17.68.
Okay, so make me smart here because I'm not too good with math. She's making $12 right now.
Right.
So, and what difference does it make if, I guess I'm trying to figure out how to understand this, okay? And I don't understand it. So it says if you're single, a living wage is $13.58.
Okay. Right? On the MIT calculator, yes.
Okay. Well, she's single, okay, and she's only making 12. And I know for a fact that she makes more than a lot of people in this area. So she's already at a disadvantage to me.
Okay.
So how does it, all right, so I'm glad this is a great chart, but it's not relevant to what people are doing and what they're getting paid and what they're able to live with, which is why we're also having to have these other plans to give them money to support themselves. And so then we're teaching them to be dependent on these extras when, in fact, if we gave them a better wage, they could actually manage their life without falling into issues of transportation and, adult care, child care, everything we all have. So I'm just trying to figure out if a babysitter makes $12 an hour and their kids in high school with no training, why our CNAs are not bumped up to be, a lot of them are leaving to go flip hamburgers or do something else because it just isn't worth all of the wear and tear on their body, the lack of pay, and all the other issues that we're trying to provide for in this discussion.
Right, and I don't think we're in disagreement on that. That's why recommendations 14 and 15 is to increase their wages.
Okay, so when it says increase their wages, it says to a regional living wage standard. Well, we're talking about the standard, right? So if you're looking at the chart, are you saying that, okay, so even though I know somebody who's making $12 an hour, does that mean that we would up it to what that is, what's on the chart, or what are you talking about? How would they do that?
Sure. So so you take the living wage numbers from, let's say, United for Alice is what we pick here, or what ultimately the General Assembly picks. So they pick United for Alice. United for Alice is broken down by county or city if you've got an independent city like, Virginia Beach. So you would basically collect up all of the counties and or cities that happen to be in that local workforce board region, and you would basically average it out. Now, since they're all in that region together, there shouldn't be that much variation between what's going to be a living wage in Suffolk versus what's going to be a living wage in Chesapeake, for example. And they would figure out that's the living wage, that's the regional living wage standard for that particular workforce board region, and that's what the wages would need to be increased to, whatever that amount is. So you aggregate the data and then you just average it out for that region.
So what have they done so far? How did we get to where we're at?
You mean how did we get to this recommendation?
No. Okay, we're making changes because where we're at is not good, correct? People are living with wages that are $9 to $12 from here in this area.
Understood. Yes. Okay. Sorry. I thought you were asking how we got to this recommendation. I'm sorry. You mean how did we get to this situation generally in the workforce?
Yeah.
Sorry.
So how did we get here? Why did we come in so low for these people to begin with?
that is a very complex question to answer. That I think would take longer than we have allotted for this meeting to be able to answer that. Part of it, I mean, this is a decades-long problem. Part of it is that the rebasing of the Medicaid rates, for example, for quite some time was not indexed to inflation. So inflation goes up, your cost of living goes up because you pay more for food, housing, all of those things. But because the Medicaid rates weren't being rebased to take into account inflation for a long period of time, the Medicaid reimbursement rates fell behind, which means that the vast majority of the facilities here in Virginia, which rely pretty heavily on Medicaid, it's usually more than 50%, they have less money coming in, they pay fewer wages, and it continues to push down, even though the cost of you living, breathing, doing all that just keeps going up. So there was an inflation issue that they weren't being rebased to take into account inflation. And even when they do, even though they have been rebased, and they do get rebased every 3 years now, and inflation is part of that consideration, if you don't keep up with it and then try to play catch up later, it's hard to catch up. And that's just for Medicaid alone, just talking about the rebasing over there to get the rates to catch up, and they're still not caught up. That doesn't even begin to get into your the other from non. Like I said, that is a very complex question to be able to answer, but it's just the money that's being paid for the care didn't keep up for a long time, and even when we've tried to readjust it to keep up, the gap has not closed, and the cost of living and income inequality has just continued to grow, not only in Virginia but across the United States. And so it's a deep systemic problem, and no one recommendation, honestly, no two recommendations in this list of recommendations that we have is going to be the fix, the one thing that's going to improve the clinical workforce availability in Virginia. It's going to be a multi-pronged attack that's going to have to take place to bolster not only the availability, but to keep people in the workforce once they're there, of which wages is, of course, a big part of that.
It's definitely a big part. Okay, thank you.
I have a quick question, if I may, if y'all can hear me. This is Megan Green from the Office of the Chief Workforce Advisor. Yeah, so for 14 and 15, what is the mechanism for that as opposed to 16 and 17? So is the idea that the General Assembly would pass, and excuse me if this has been addressed previously, if this is just for my education, but is the idea that the General Assembly would pass almost like a minimum wage bill, but specifically for CNAs, and then it would be proportional to living wage standards versus the raise them by rebasing the Medicaid reimbursement rate?
Yes. So this would, these would all have to be legislative solutions, these recommendations to be put in. They'd all have to come through the GA. So, it would have to be some legislation from the GA that for 14 and 15 is targeted specifically at the wages for CNAs.
Okay. And do you have any information about, is that something that other states have done as opposed to these recalculations of the Medicaid reimbursement rate or wage pass-through programs? They've actually just passed a bill that says this is almost the minimum wage standard for CNAs. Is that something that other states have that is maybe more common or less common than this alternate approach you have here for 16, 17?
So 16 and 17, we've actually, I think, and I will defer to Scott Johnson, April Payne, Dana Parsons, and the rest from the industry on this. My understanding is we had a wage pass-through program back in 99 or 2000. So we,
I think that's right,
as a state, done this before. And I think part of the reason, if my recollection is correct, that 16 and 17, the wage pass-through program, eventually went away is because when they implemented it, it was, DMAS is the one who had to administer it because it's Medicaid, but they were doing a 100% audit of every single long-term care facility to make sure that they were doing it, and the burden to the agency got so high that it got phased out. I think is ultimately what happened, is that it was such a burden to the agency in terms of time and resources and money to do these 100% audits that instead of reforming the program and maybe doing randomized audits, for example, to make sure that the wage pass-through program was actually being implemented at individual facilities, it just got scrapped.
Gotcha.
But for 14 and 15, I don't have, for 14 and 15, I do not have specific data about what other states have done to set wages specific for CNAs or any other specific type of profession. I mean, at least in the CNA case, you'd know who they are because they, we have a board of nursing that can tell you who the CNAs are. But I don't have any specific data about that. It was the reason it's about CNAs is because so much of the conversation to date in this work group has been focused on the CNAs and their wage disparities that they face and income inequalities.
Gotcha.
But if we wanted to expand it so it's not CNAs and it's instead and all of the folks who do direct care at a facility, we can do that. That's, like I said, this is just a slate of recommendations to be voted on, not the slate that we're actually putting into the report.
Okay,
We'll have to go for a vote.
That's helpful just for us for the voting, understanding kind of the difference in the logic between 14, 15, and 16, 17. I wonder if there would be a reticence to establish a kind of, almost minimum wage standard for a particular occupation in the GA for fear that it could be expanded later on. I just wonder what the conversation would be about that. So thinking about 14, 15 versus the approach in 16, 17, that's helpful to understand. So thank you.
Right. Yeah. And
Megan, are you talking about a specific number? Megan?
I'm sorry?
I said, this is Sam Kukic. So are you referring to the fact that it might be difficult to put a specific number on there, that they would shy away from that?
I just mean that a bill to establish a certain minimum wage, like a standard of payment for one specific occupation, there could be fear of it being expanded to other occupations in the future and being broadened.
Well, I think it's interesting because I think the CNAs would jump for joy if they knew that they could depend on a definite number instead of what they're doing now.
Right. I think they would be able to with the wage pass-through program as well. With this, that also includes the regional living wage standard piece. So, go ahead. Sorry, I interrupted someone.
Rebecca, this is Scott. I was just going to share, I'm not aware of any other place for a healthcare provider in the code that the General Assembly has spelled out what they get paid for per hour. I'm aware that in Medicaid, under fee-for-service, that sometimes they have told the Medicaid MCOs that they've got to pay a percentage of fee-for-service as far as a reimbursement amount. And obviously in the special session, there was an attempt to clarify sick leave pay, and of course there have been attempts to, in the 2020 session, to increase the minimum wage for the state. But as far as something unique to healthcare providers, I think it's been dealt with more as an aspect of Medicaid reimbursement as opposed to saying XYZ professional is going to get X amount per hour.
Well, Scott, with regard to that, don't you think that with COVID and all the issues that are happening right now with all the CNAs and medical workforce, don't you think that might be something they might consider?
They didn't during the special session at this point in time. Doesn't mean they won't in the future.
This is Todd Barnes. Can you guys hear me?
Sure can.
So being a nursing home administrator myself, I want to just interject one thing that you got to keep in mind since it was brought up about COVID. You got to keep in mind that with us having to test, and some facilities across the state are having to test twice a week, when you're in a building my size, and keep in mind, though, also, we do pay our CNAs very well compared to the competition. But when you're testing in a building my size, and we're testing 400 twice a week, that being our staff and our residents, each time I test, that costs me over $30,000. So I'm running up a bill weekly of $60,000. Now you extrapolate that on just 1 month. That's almost $250,000 a month. So while I do advocate giving the CNAs as much money as we can because they definitely earn it, think we're losing sight of the fact that there's so many that if we're not careful, these past few months and moving on, even though we've got some money from the CARES Act, that's not going to last you but about a month or two if you're testing twice a week. And so if we're trying to push through more money across the board at a bottom level, I'm afraid that's going to be pushed back because of all these other expenses that we are getting. And I think one of the things that we miss is this. One of the things that I'm able to do to keep my staff is I do so many other things to let them know that they are valued. And I think we're missing that piece. Now, I don't know if there's anything we can put in, but I'm just saying administrators need to let their CNAs know, because I can tell you in the 12 years I've been doing this, yes, they all want more money and they deserve more money. However, the recognition from the top down means just as much as them. And I just think there's a couple of things we need to keep in mind as we're trying to set a baseline that I don't think is going to get pushed through anyway. Just my thoughts.
All right. Thank you, everyone, for chiming in on this one, and Mr. Barnes, especially on the issue of the non-monetary but still important value that people can get from their job, just in terms of like their leaders and their supervisors, recognizing them and valuing them for their job that they do, even if it's not always in the monetary sense. So, a couple of things. For 14 and 15, I absolutely recognize that is a big swing for the fences in terms of being able to accomplish it at the GA. It may be better that we rewrite 14 and 15 instead of it being increased wages for CNAs specifically. Instead, just make it a across the board regionalized wage, minimum wage essentially. So that it is tied to the living wage standards either through United for Alice or the MIT living wage calculator. So if you are fine, if you all are okay with me tweaking it, so it's no longer CNA specific, but it's to the benefit of everyone in Virginia, that the minimum wage goes up and it's tied to the regional living wage standard. I'm more than happy to tweak those. I also want to make note, Dr. Carter just messaged me and said that current 2019 median income for CNAs is $13 to $14 per hour. The median wage, let's see, yeah, that's the median wage. That 16% of CNAs in 2019 made $11 or less, and 42% made $14 plus per hour. I believe I'm reading that correct, Dr. Carter. So she just wanted to share that information with you all. Okay. So
if I can just make a comment about that.
Sure.
Not trying to be argumentative. That sounds great, but I don't know anybody in that category that is a CNA in this area.
Right.
So, I mean, I'm glad those are the thoughts, but I don't see the reality of that. And I just have to speak up for them because I know that not to be true.
Okay. Well, I know that Dr. Carter's numbers are coming from the surveys that folks fill out when they are renewing their license, and that's the statewide numbers. That's not we were looking at Williamsburg earlier, or not Williamsburg, sorry, James City County earlier. She's talking statewide numbers there, so it's not broken down by specific regions. So if you all are okay, I will fix 14 and 15, since we had some concerns about the massive political headwinds you'd be sailing into on 14 and 15, and just make it increase wages for everyone in the particular region. So I'll tweak 14 and 15. And also, you may recollect from the meeting invite that I did not have this meeting going for 3 hours this time around because of some other obligations that I unfortunately have on my calendar. So we did not get as far as I was hoping today, but I think the discussion that we have had today has been incredibly productive. So if you all are okay with it, knowing that we need to definitely get through the rest of these, plus get started on the writing so that everyone in this work group has time to review the draft and to offer comment on it. Let me look at the calendar. I would like to meet again next week. Is there anything next week that is a no-go day for folks? That it's already booked up, can't do it, overcommitted? And like I said, I know this is kind of a short turnaround, but I feel like we're making good progress, that we've got a lot of momentum here, and we are so close to the actual drafting of the report that I want us to get there so that we all have time to review the draft when it's prepared. So please let me know. I'm sorry?
Vivian McDaniel, if you're planning on doing it on next Friday, I have a meeting. I have meetings starting from 12 that end at 3.
Okay. All right. Are there any issues?
On Friday.
I'm sorry, Ms. Seymour?
I said I would also not be available on Friday.
Okay. Does the 1st look better for everybody? Which is a Thursday. Sorry, I should clarify.
For me, again, Vivian, I have a meeting with the COVID long-term care workforce group from 10, I think, to 11:30.
Mm-hmm.
And then I have another meeting that starts at 3, so it depends on what time you would do it on the 1st.
Okay. And is Wednesday any better for folks?
Hey, Rebecca, Wednesday morning is the Joint Commission on Healthcare.
Oh, nope, not doing it then.
But Wednesday afternoon, I don't know if that looks good on my calendar. I don't know about other folks.
Okay. My Wednesday afternoon's fine. I know Dr. Carter's saying that she can do afternoons on Wednesday.
I can do afternoons.
That works.
Yeah, that works for me.
All right,
Rebecca.
perfect. I will send, yes, who's this?
Tyler from Senator Pickens' office. So I think
Yep.
Wednesday afternoon would be best for us because the Senate's going to be in session both Thursday and Friday, and then
Gotcha.
she is on joint healthcare Wednesday morning.
Perfect. Okay, I will send out an invite by close of business today for a meeting on Wednesday. It'll have all the meeting materials on it. It's going to be the same presentation that you've seen, except I will update the recommendations we've already talked about so you have the updated language in front of you. Okay, but I'm not planning on circling back to the ones we've already talked about. We'll pick up on this slide on our meeting on Wednesday. So thank you again, everyone. I'm so sorry to cut this short because, like I said, we had some good momentum, some good discussion, and I hope you all bring it to the table again on Wednesday so that we can get this wrapped up and get the drafting started. So thank you, everyone, so much for your time today, and you all have a great weekend.
Same to you. Bye-bye.
All right, bye-bye.